Hello everybody, it's Dr. Renée and I'm back for my weekly medical vlog. This week Kim has asked me to give a brief overview of autism, so that's what I'm going to do. So what is autism? Autism is a lifelong developmental disability and it affects the way that people see the world. They see it differently to you and I. It affects the way they communicate with others, how they interact with others and how they behave. And it's very much a spectrum disorder. And what I mean by that is that everybody with autism will share certain traits which have gone towards making the diagnosis. But on top of that, they will have a whole heap of individual, unique characteristics which make them the very special person that they are. And we see a vast range of condition. So people that have autism vary dramatically in how they manifest their condition and what kind of person they are and what their particular issues are. But it certainly does create a very unique and special person, and that's the way I think we should all see somebody who has autism. So over the years, the research into autism has changed dramatically, and it's still changing all of the time, and frankly we don't know enough about autism, but we are striving to learn more all of the time, and there is research ongoing all of the time. The result of that, however, is that the name that people have used for autism has changed all of the time and still varies from place to place. So for the purposes of this video, I'm going to call Autism Spectrum Disorder, or ASD, because that's what it is. But it has been known over the years as classic autism, high functioning autism, Canner autism, autism spectrum condition, Asperger's syndrome, pathological demand avoidance, and so on. So you can see that we don't know enough, and therefore the name has changed variously. So who gets autism? Well, we know that it's a disease of childhood and it's generally diagnosed under the age of 3. However, that doesn't mean that you can't be diagnosed as an older child or an adult, and there are various reasons for that. The diagnosis may have been missed, it may have been misdiagnosed and then re-diagnosed, or nobody's ever made a diagnosis. We do know that there are 700,000 people living with autism in the UK, and those are the people who have a diagnosis, so the number is probably higher. About 1 in 100 people have autism, and we know that it affects boys more than girls. But again, as with all of these medical stats, as I think I'm showing you week by week, again, the figures that we have vary greatly. So some studies say it's as low as 2 boys for every girl, but then other studies have shown that it's as high as 16 boys for every girl. So the answer is, we don't know what that figure is, but we do know that it's more boys than girls. So what causes autism? Well, again, we don't absolutely know. We do know that there's a genetic involvement because it often runs in families. Some parents have more than one child with autism. We think there might be an environmental trigger. So for example, being born too early or prematurely, being exposed to alcohol or medicines in the womb are ideas that have been put forward. But there is no conclusive evidence for this. So again, we don't know. What we do know is that autism is not caused by the MMR vaccine. That has been absolutely proven now. We also know that autism isn't caused by mercury in other children's vaccines. So you can safely vaccinate your children and protect them. We know that it's not caused by diet. And we also know, and this is really important to me I think, it's not caused by bad parenting. You know, there are people out there saying that children with autism are just badly brought up or are affected by parenting. That is absolute rubbish. So please, if you're a parent with a child who has autism, it's not your fault. Absolutely not. It's nothing that you have done, and you are probably the one rock in that child's life. So get that out of your mind and tell anybody who says it that they're speaking rubbish, because Dr. Renée says so. Now, I think I've proven to you that I don't always stick to the textbook when it comes to these vlogs, and I'm going to veer off of it now as well. So in the research that I've done for this vlog, the one thing that kept popping up and popping up, so made me delve a little bit deeper, was gut microbes and the role that they might play in autism, both in causing it and potentially treating it. So what are gut microbes? Well, in our gut we literally have hundreds, thousands of millions of bacteria. But don't worry, it's friendly bacteria, we need it. It's doing a job in our gut. It's breaking down food, making metabolites that are the building blocks for so many things inside our body. Now, it's been discovered that children with ASD, when they look at their poo, which is a nice job, I'm sure you'd agree, they find that they actually have different gut microbes to children without ASD. And some of those gut microbes, we think, are connected with neurotransmitters. And neurotransmitters are the messengers between the nerves in our brain and all over our body. So that's quite interesting. And when you think about autism and the way that children interact, it's probably neurotransmitters that have a role to play in that. So that's one thing that they've discovered. They've also discovered that in the gut of mice who have missing social interaction characteristics, so they're not interacting well within their mouse community, very much like children with ASD, they are missing a particular bacteria from their gut microbe. That bacteria is called Lactobacillus reuteri. I don't know if I've said that right. Again, it's one of those impossible words. And what the scientists also found, which I think is really exciting, is that when they added this gut microbe back into the mice, they actually reversed some of that missing social interaction and they became more social. So that surely holds out lots of hope for the future in terms of treating humans with autism, not just mice. They also found that in children with autism, they too had lower amounts of this bacteria in their gut. They also think that this might have a role to play in the release of oxytocin from our brains. Now, oxytocin is the love hormone, the social hormone. It's the hormone that makes us bond with people, particularly with our children. So that too must play an important role. And I think it's really exciting that this work is ongoing, and there is information about this on some of the charity websites, and I will put these in the description afterwards so that you can have a look. But I thought that was quite exciting and worth putting out there, something to research. So what are the signs and symptoms of autism? Well, initially it's divided up into areas, and language is one of those areas. We find that children with autism tend to have fewer words than those without. So at the age of 2, they will most likely have less than 50 words. They'll prefer to use single word speech rather than sentences. They'll have a monotonous, flat tone of speech, and they'll quite often have words or phrases that they repeat over and over. So language plays an important part. How these children react or respond is also slightly different. So they don't respond often to being called by their name, or they respond negatively or not at all to any kind of interaction trying to attract their attention. And they will quite often reject cuddles, although they'll also quite often come for cuddles, but it has to be on their terms rather than you initiating it. Then interactions with other people and other children. They'll quite often avoid eye contact. They'll have a lack of awareness of your personal space, but at the same time they'll be very aware of their own personal space and not ever want it to be encroached. They won't like to interact with other children or people, adults, and they'll avoid things or try to avoid things where they have to interact with other children, like children's parties, for example. They'll often prefer to play alone and have fewer gestures or facial expressions. And then behaviour. So they'll quite often have repetitive movements like rocking. Repetitive play, which is unimaginative, so there'll be no talking between toys or imaginary friends. They quite often have strong food preferences for colour or texture. And they'll use their senses in a different way to you and I. So they might smell people or other children or toys in a way that we wouldn't do. And they quite often don't like change, so they prefer routine, and change can be really distressing for them. So I quite often get asked, that's fine in toddlers under 3 as in terms of a diagnosis category, but how do you do that in older people, in teenagers or adults? The answer is that it's very similar but slightly adapted. So in an older child or an adult, again, they will avoid speech or long sentences wherever possible. They'll miss cues. They'll talk at people without realising that they need to stop, let other people interact in the way that we find quite natural as adults. They'll take things very literally and often miss sarcasm. They'll misunderstand social interactions, so they won't pick up on cues that would normally tell somebody that somebody is upset or angry or sad. And they'll be unable to adapt their speech tone or content to the social situation. And quite often they also lack facial expression. So you can see it's similar, but just slightly more adult in its content. I think it's quite important to know that ASD quite often is associated with other conditions. So it's always important to look for those too, especially as a professional. So the kind of conditions that ASD is often associated with are cerebral palsy, Down syndrome, epilepsy, ADHD, Tourette's, OCD, Fragile X, tuberous sclerosis, anxiety disorders, sleep disorders. That list is by no means full. There are lots and lots of other things, but I can't list them all here. But I think the point is that it's important to know that people that have ASD often have other things as well. So how do you get a diagnosis? You see your friendly GP or a health visitor if you don't want to do that. The important thing is that you see someone. It doesn't matter how small the thing is that you're worried about. If you have a concern, please see somebody, because an early diagnosis is important, and it's much better that you go early and you're wrong than you go late and you're right. So even if it's just one thing on that list of things that I read to you, go and discuss your concerns. It may be nothing, but if it isn't, you need to get a diagnosis. So your GP or health visitor will refer you to a specialist team, and it will be a multidisciplinary team made up of lots of different people, made up of a paediatrician, a speech and language specialist, occupational therapists, maybe a counsellor, physiotherapists. Essentially, it's an expert team in all areas that might be needed. They will do a thorough assessment, so they'll speak to you about your family history, the history of your child, the birth, milestones, the things that you're concerned about. They'll do a physical exam to make sure that there aren't one of those other associated conditions sitting alongside the problem, or even causing the problem. It may be something else. And from this series of assessments, you'll get a diagnosis or not. But once you've got that diagnosis early, it's really important. And the evidence shows us that the earlier we get the diagnosis, the more impact we can have in terms of the interventions that we make. We can minimise the effects that ASD will have on the child's life, and we can implement really good coping strategies and the skills that they'll need to navigate the world that they see differently. And that's what it's about. It's about maximising the potential of the child so that they can handle the world. And as they're seeing the world differently, those skills are different to the ones that you and I need. The other thing about getting an early diagnosis is it also brings with it important financial things, so benefits, carer's allowance, a statement for school. So there are specific services that you'll be plugged into, and there are benefits that you'll need because your child will have extra needs, and it's important therefore to get them as early as possible. Now, in terms of treatment, there is as of yet no cure for ASD, although as I showed you earlier with the gut microbes research, who knows what the future might bring. The most important thing is that we use education and intervention to help the child or adult in their communication, education and their social development, and those are the things that are focused on. As I said, somebody with ASD is a unique individual, and so all of these things have to be tailored, looking at that person and making sure that it fits entirely their needs. It'll be focused on communication, so for example, using pictures to help communicate, doing enjoyable things that don't involve communication, just fun things. Teaching interactions, learning how to respond to social cues, facial expressions, feelings. So even if the person with ASD isn't feeling or picking up on those things naturally, they can be taught how to judge someone's facial expression and how to respond, and that's really important. helping the imagination, so encouraging imaginative play and how to interact with others in play. And then academically, maximising reading, writing, and just ensuring that every single child or person with ASD reaches their potential. And that, I think, is the message. Then that potential can be anything. And just like anybody without ASD, we all have a different potential level, and we all should be helped to reach that. And it's no different for someone with ASD. Then there's the parents and carers. We mustn't forget them in all of this. They are crucial in the package that we put together to help this child or this adult, but also it's important that they have support as well. And they will have support not only to make sure that they're okay and that they're handling everything okay, because it can be a big shock, but also to help them develop the skills to support their child and help them navigate the world. And there are lots of charities out there, as well as the NHS, that have different schemes available for parents and children to tap into to get the support that they need, unique to them. But the kind of tips that we would always give parents when dealing with a child who has ASD is always try and use their name, and use it more often than you would normally with a child without ASD. Minimise background noise when you're interacting, because that can be an overstimulus or an arousal that a child with ASD might find distressing. Use simple language, use extra time for them to process that language, and speak slowly and clearly with lots of pauses. Then psychosocially, we need to supply counselling to support, again, both the child and the parent, and to give supportive counselling, the tools for overcoming challenges that there will inevitably be. I'm not going to pretend that there won't be challenges, there will be, but it's important that the parent and child is given the tools to try and overcome them, and also to support their mental health. So for the child and anyone living with a lifelong condition, mental health can be affected, so it's important to make sure that their mental health is as healthy as can be, and the same for the parents, because this can be a big blow and it can be a big shock and difficult to deal with. So it's important that we help the parents overcome that as well, and the carers. And then, by no means the mainstay of treatment, we can use medication, sometimes to just overcome some of the symptoms or side symptoms of the condition. So for example, we could use medication to help sleep when that's poor, to help anxiety, to help depression, to sort out epilepsy, ADHD, and then if there's aggressive behaviour, for example, to try and help that. So there are lots of tools available to help. And alongside the myriad of structures that the NHS offers, and there are teams in place that you will be put in touch with to help your child navigate growing up with you alongside as the specialist person. There's also lots of charities like the National Autistic Society, autism.org, and I will list all of these in the description afterwards so that you can tap into their resources, and they have lots of resources. And it's just important that you choose a strategy that works for you and for your child. And as a parent, I guess some of the tips would involve structure and safety. Be consistent, have a schedule, routine, reward good behaviour, and have a safe zone at home where your child feels safe and protected and doesn't have distressful things coming in from the outside. Find non-verbal ways to connect and have fun, so a day out at a theme park can be just as fun as sitting playing on the mat and talking. Have a personal plan, so a personal plan for your unique child with ASD that builds on their strengths, builds their skills, and that they enjoy, because that's crucial. And this is a unique human being, and it's really important that we maximise their potential. And always access help and support, and as I said, there's lots out there, and I'm going to list it afterwards for you. So hopefully I've shown you that this is a complex condition about which we don't know enough or very much at all, but there is research underway. It's definitely multifactorial. There are lots of things that cause this. It's a spectrum, as I hope I've shown you, that there are many associated conditions that we need to think about. It definitely needs an individualised approach, and every single child is unique, special and different. It's lifelong, so we have to accept that we're going to be living with this forever. and as we get older our needs will change. That parental and family support is absolutely key in the life of this young person, and so you need as much support as the person with ASD. So I hope that's given you a brief overview, and I'm sure you've got lots of questions and I may have not answered them, or I may have got things wrong, so please tell me, ask me questions, I'll always answer them. And access all of the information that I'm going to put in the description. And let me know if you've got any other videos you want me to do in future. Thanks again for subscribing and watching.